Hello everyone and welcome to my capstone project for South University PA program of West Palm Beach. So my topic for my project is the management of acne and how acne affects quality of life. My target audience is high schoolers. So just a little bit of a disclaimer, the information presented is compiled from a variety of peer-reviewed and non-reviewed sources, so none of the research is of my own, so all rights are preserved by the original publishers and all resources will be cited at the end of my presentation. The information that I will be talking about is not medical advice, so please consult your dermatologist or medical esthetician to aid in decision making that is targeted towards your own skin type and skin issues. The points that I will be discussing do not reflect those of my educational institute, so this institution will assume no responsibility for the information I will be presenting. Hello everyone. I just wanted to introduce myself. So I'm Jordan Feltis, and I wanted to tell you a little bit about me. I am a skincare fanatic. I will admit I have been obsessed with taking care of my skin since I was in middle school, and my mom first gave me my first three-step routine to clean and cleanse my skin. So my skincare routine has definitely evolved over my 28 years. So I was always that girl in high school and college that was always constantly applying sunscreen and always taking care of my skin and giving my friends even skincare advice. My love for skin and helping others deal with acne is one of the reasons I actually went into medicine. I originally had actually wanted to be a dermatologist, but in the long run, I realized that a PA career was a better route for me. So actually, I'm hoping to become a physician assistant specialized in dermatology. So my background is that I actually worked as a medical assistant in dermatology for about over 4 years. I've worked for 3 different dermatologists. So I've definitely seen a lot of different varieties of treating acne, but also a lot of similarities. So but unfortunately, I've seen a lot of lack of getting down to the root of the cause of acne and more just superficially treating it on the surface than figuring out what could be causing it and also how it is affecting those who are dealing with it. So this can be quite difficult, although, to find the actual cause of acne because there's so many different things that can trigger acne and be the cause of it. But just a little bit about the PA profession. What I'm striving to do as a career is the physician assistant profession was originally created to help with the shortage of physicians, and so much has changed since then. PAs are advanced medical practitioners with a master's degree who can diagnose, treat, prescribe medications, assist in surgeries like Mohs surgery to remove skin cancer, provide patient education, prevention care, and work in almost any specialty. So physician assistants provide a greater access to healthcare and improve patient health outcomes. So a little bit of why I picked this topic of management of acne and how it affects quality of life and how I feel like it is significant to high schoolers is that it's something I'm very passionate about and I'm very comfortable talking about because I myself have dealt with acne pretty much since puberty, and I feel that I can really connect and answer questions, and I feel like I'm very easy to talk to, and I've been on the other side. So I know how it affects your self-esteem and how sometimes you just don't want to go out and see people because you feel like they're just looking at that craters on your face or all that acne that you could be dealing with. So, I've had my bad skincare days and figuring out what works for me. So I want to help others figure out what could possibly work for them. So just a little bit about the health people 2030 and how my topic applies to their initiative. So basically their overarching goals are to attain healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature health. So they want to help attain health literacy and improve the overall health and well-being of all. So I feel like this applies to my topic specifically because I've explained that acne has, some psychosocial effects on, and it's important that we educate those being affected, especially high schoolers, on the different ways they can treat and deal with their acne. acne, and how to manage it, and also how to prevent it. And acne is one of the most common skin conditions, diseases that is affecting people in the world. So it is best if we try to prevent, the aftermath of dealing with acne, and then, try to treat it and prevent. So that is going to be, that's just a little bit about me today. So we're going to start with a couple basic facts about acne. So the full name is acne vulgaris. It is one of the most common skin diseases in adolescents. And adolescents are particularly impacted by acne, with a prevalence rate of 85% in Americans aging 12 to 24 years old. So this type of rate is the portion of persons in a population who are particularly affected by a particular disease in a certain point in time. So acne can cause a significant negative impact on quality of life of young people who do not accept their appearance. So this poses a significant medical problem because it affects the physical sphere and the mental condition of the ill person. So acne has a very complex development that requires preventative and curative treatment from a dermatologist and a cosmetologist or esthetician. So by recognizing the new mechanisms of the disease, we can develop new therapy methods to offer a more efficient way of helping those suffering with the most severe forms of acne. So by working with a dermatologist, an esthetician, or cosmetologist, we can better help high schoolers treat, manage, and prevent acne. So having that cooperation between a dermatologist and a cosmetologist or esthetician can improve long-term therapeutic effects, and in consequence also help with the satisfaction of the patient or client. So now with, adolescents or high schoolers being my target audience, so we need to understand how adolescents perceive and look at acne, their certain perception. So we need to talk to the patient first. That is absolutely most important with treating certain conditions. How are they feeling? What do they know about the condition? So a study was conducted in 2020, and it aimed at exploring young people's views and their experience of acne in treatment. So what was found in this study is that acne is often perceived as short-term and a self-limiting condition in adolescents, and this appears to have implications for certain high schoolers, seeking treatment or advice for their condition. So participants widely saw topical treatments as being ineffective and related this to, unrealistic expectations around the speed of onset. And most participants felt they had tried almost everything of topical treatments, and they just were unsure what was in them, all the ingredients, or unaware of differences between certain cosmetic and pharmaceutical treatments, because there are so many different treatments for acne out there. And also, these participants in the study were not very sure if they were using the topicals properly or how to avoid side effects. And they were, also unsure about certain side effects or the necessity of oral treatments like antibiotics. And very few did not seem aware of what we're dealing with now also in, dermatology with acne, is the increasing antibiotic resistance. So we're going to talk about the different types of acne. So if you see in the first photo at the top, this is a generally healthy hair follicle. And so, we have 3 layers of skin: the epidermis, the top layer, middle layer, the dermis, which includes the, the sebaceous glands and the hair follicle, and then the hypodermis, the fat layer. So the epidermis is generally, where you'll see the, acne form. So looking at each of the different types, so we've got a blackhead, which is an open comedone. So you can see it, it opens to the surface and it turns black. Then you have closed comedones or milium or whiteheads. They stay below the skin surface, and they kind of, you see a skin that kind of forms over the sebum, which is those dead skin cells are building there. And then you regularly have a papule, which is a small inflamed bump. Then you have a pustule, which is inflamed bump with pus where it's broken through the skin. So that's where you'll see kind of like that white head. And then you have a cyst or a nodule. This is an inflamed, painful bump that's, deeper in the skin. You can see it's going deeper down in the dermis layer. And, as you can see in the lower picture, this is kind of what it looks like, in person. You got the pustules, the whiteheads, which whiteheads can become inflamed too. So, there's a difference between whiteheads and pustules. Again, whiteheads are closed comedones that stay below the skin surface, and pustules have come up to the surface with that pus or with the bacteria. And then cysts, which are deeper down. Milia is, a type of closed comedone. This is more common in younger adolescents. And then you got, again, showing you more closed comedones there. And papule, and then blackheads. So, these different types of acne are grouped into inflammatory acne, comedonal acne, and cystic acne. So just to briefly go over the 3 different stages of acne, stage 1 is mild, stage 2 is moderate, and stage 3 is severe. So stage 1 mild usually consists of blackheads and whiteheads with sometimes some papules and pustules, and the lesions are usually, the number is about less than 30. Moderate is usually a higher number of blackheads, whiteheads, papules, and pustules, lesions the number about 30 to 125, and then severe is pretty painful and large papules, pustules, nodules, and cysts with pretty severe acne scarring occurring. So lesions, the number is about over 125. When diagnosing acne, we do need to make sure to differentiate it from other conditions that are very similar looking to acne. So firstly, we're looking at rosacea. So rosacea is a skin condition that results in redness or rashes on the face. It can also cause acne, but generally it appears on the cheeks and on the nose. And some people will even get what's called telangiectasia, or broken blood vessels on the cheeks, but it's generally more redness than it is papules. Next would be keratosis pilaris, or KP. This is a condition of skin that causes small, rough bumps. This actually usually occurs on dry skin on the arms and the thighs. As you can see in the photo, KP is not really inflammatory like acne, so it's pretty easy to differentiate. Next is hidradenitis suppurativa. This condition causes painful spots and severe scarring. These usually occur near hair follicles that are near sweat glands, such as the armpits or the upper thighs, but they also can occur on the face, like shown in the photo in C. So it does look like acne, and the 2 conditions actually can occur together. Both start from inflammation in the hair follicles, but the best way to tell the difference is that HS actually forms rope-like scars on the skin, while acne does not. All right, looking at D, perioral dermatitis. This condition results in small red papules around the mouth. These papules may be red, dry, and look more like a rash. Again, acne is kind of more spread out, and perioral dermatitis is not. Lastly is chloroacne. So chloroacne is pretty uncommon and usually results in blackheads on the face or body. It is a result of someone coming into contact with certain chemicals. So a person's acne stage may change over time with their hormones, stress levels, and other life factors. So all this plays a part in the severity of acne. So everyone responds differently to medications, and acne treatment plans can change over time and may involve different combinations of treatments and may require different treatment strategies for acute flare-ups versus long-term maintenance of clear skin. So generally about 2 to 3 months of consistent treatment is usually needed to actually assess treatment success. So a couple different treatments. One of the first most common ones is retinoids, which are vitamin A derivatives. So we have topicals like tretinoin, retinol, which is over the counter, adapalene like Differin, which is also over the counter, tirazetine and trifrotein, which is Acleaf, and oral, which is isotretinoin or Accutane, which most people are aware of this. So there's varying strengths of action for each retinoid. So generally a retinoid, what it normally does to the skin is it stops oil production, and it usually normalizes keratosis. Keratosis is a growth of keratin on the skin or in the mucous membranes that stem from the keratocytes, which are the prominent cell type in the epidermis, which is the top layer of the skin. So Retinoids also prevent formation of microcomedones, so they have an anti-comedogenic activity. They also stop the development of the bacteria that can cause acne, and it also can indirectly reduce the intensity of inflammatory reactions through a change of the environment that the bacteria that causes acne does not like. If you use a retinoid, you should make sure you're always using sunscreen and not having direct contact with the sun, like not going to the beach or going on the boat after using a retinoid the day before or the day of. A treatment with local retinoids, the topicals, especially if you with dry skin, it usually you should begin by first using it once at night every 3 days, and that would be like the first week. And the second week, you then going on to using it every 2 days, and then the third, fourth week, and so on. You can use it, every day. But it's a slow process to work up to get your skin used to it. So isotretinoin Accutane, it is FDA approved for the treatment of severe acne, and is also recommended for moderate acne, which that is treatment resistant. And usually, severe acne obviously can lead to severe scarring, like those ice pick scars, like the deep in the skin that it's very visible, and obviously this can cause psychosocial distress. So isotretinoin works by targeting all components associated with acne, and it decreases sebum production, it decreases bacterial growth, and even shows anti-inflammatory effects. So a 2017 meta-analysis revealed there's no increased risk of depression while on isotretinoin, and actually saw an improvement in depressive symptoms after treatment, although there are some cases that there was a change in mood reported with people who were clinically unstable. So one of the things that generally dermatologists do when someone is on isotretinoin, male or female, if they have any history of mental or psychological disorders, they have to get cleared by a psychiatrist or psychologist. So it is generally considered safe, but there are some clear side effects. So you cannot get pregnant while on this medication because it can cause embryotoxic properties. So isotretinoin is monitored by the FDA via the risk evaluation and mitigation strategy. It's termed iPledge. So basically, when on this, girls, they have to make sure they're on a form of contraception, whether that's abstinence, birth control, like oral contraceptives, and so forth, because it is highly embryotoxic, and you should not get pregnant while on this. Okay, so benzoyl peroxide, this is pretty mainstay in over-the-counter treatment of acne. So it generally is antibacterial, and it can reduce bacteria by about 90%. So azelaic acid, it is tends to focus more on antibacterial activity, is anti-inflammatory, and it also can inhibit and reduce post-inflammatory discoloration in acne, which is after acne has gone away. It's generally used about twice a day in the forms of creams and gels from concentration to 15 to 20%, and it sometimes can be used in chemical peels. So antibiotics, there's topicals and oral. So topical antibiotics are the most recommended and frequently used are clindamycin, azithromycin, and davarcin. So but it's been seen in recent years there's been an observed common increase in resistance in antibiotic use for external use, generally with erythromycin and clindamycin. So these topical antibiotics are antibacterial, and they also are shown to have a quick disappearance of papules and pustules, especially in comedopapular pustule acne, but should not be used as monotherapy, which means not used alone, because of the rapid development of high rates of antibiotic resistance after weeks to months of use. So oral antibiotics, we have doxycycline, sarecycline, also called Seysara, minocycline, and azithromycin. So they're generally indicated for the treatment of moderate to severe acne or mild acne that is reluctant to topical therapy alone. So this can generally be used in combination with topical retinoids and or benzoyl peroxide, but used alone is not recommended. Therapy should generally be temporary. As it should bridge to topical medications usually. Long treatment is about 3 to 6 months, but this should be avoided to limit the development of antibiotic resistance. So one of the, biggest concerns obviously is, antibiotic resistance. So to avoid resistance, again, they should be limited to a 12-week course and should be used alongside retinoids or benzoyl peroxides. And also it's very important when using oral antibiotics because again, you have to think it is destroying all of the bacteria in the body. So that is good and bad bacteria. So you should make sure that you are on a probiotic while taking oral antibiotics because, it can cause yeast infections and by taking a probiotic, you're maintaining that good bacteria in the gut, which is super, super, super important for health. So some hormone-based therapies. There are currently 4 combination oral contraceptives approved by the FDA for the treatment of moderate acne in post-menarchal girls, which are after their first occurrence of menstruation. These combination oral contraceptives can decrease both inflammatory and comedonal lesion counts. Some other hormonal treatments are like topical clascoterone, which is, I can't say it, sorry, and oral spironolactone. So spironolactone is not FDA approved for treatment actually, but is pretty commonly used by dermatologists. But it should be emphasized that with use of oral contraceptives, there is a well-established increase in frequency of blood clotting, and this can lead to life-threatening conditions such as pulmonary embolisms. And so this type of treatment should be used with caution. So chemical peels, their main role is to basically re-regulate the keratosis process. So it basically will remove dead skin cells from the top layer of the skin. They also can have an inhibitory effect or stop the process of skin hyperpigmentation and improve the look of acne scars. And obviously after a treatment with chemical peels, you should avoid sunlight. So some common exfoliants, these are generally all over the counter, pretty well known. This would be alpha hydroxy acids and beta hydroxy acids. So alpha hydroxy acids are water-soluble acids that are derived from sugarcane and other plant sources. They help stimulate collagen and they exfoliate and increase the shedding of dead skin cells. So some examples of exfoliants would be glycolic acid and mandelic acid. And beta hydroxy acids or oil-soluble acids that get down to the pores and cut through oil to remove excess sebum. And they're known to also fight bacteria. And the most common beta hydroxy acid is salicylic acid, which is pretty common and used by a lot of people. But you just want to make sure you do not want to layer alpha hydroxy acid and beta hydroxy acids on top of one another because they are both exfoliators. So using both can cause drying of the skin and it causes irritation. So some treatments that can be provided by some dermatologists or licensed estheticians is microdermabrasion and light therapies like red light and blue light. So microdermabrasion is a type of medical peeling. It consists in the removal of dead skin cells as a result of the use of a specialist exfoliating the epidermis using a minimally abrasive instrument such as a wand to generally sand the skin, as you can see the picture there of the woman. Some benefits are smoothness, brighter complexion, evened out skin tone, reduced appearance of dark spots, and cleaning out the pores. So light therapy, again, red and blue light. So red light therapy can reduce inflammation and stimulate the production of collagen. which is a protein responsible for younger looking skin that can diminish with age. Blue light therapy is more about destroying the acne-causing bacteria. So after treatments, any exposure to sunlight must be avoided due to the possibility of phototoxic reaction of the skin, which is a rash that can occur. And as you can see in this little diagram, it's a little bit easier to kind of like see, like depending on what type of acne you have, the type of treatment you would use. So generally for mild acne, again, which is stage 1, you'll use topical medications, like usually moderate and severe acne, and then along with mild acne that does not respond to the above treatment. So there's oral antibiotics like doxycycline, minocycline, Seysara, and the hormonal treatments, and oral retinoids like isotretinoin, which is more for severe acne. So we're going to go ahead and we're going to do a learning activity. Our first one, it's going to be a guessing game. I'm going to present a photo and you're basically going to guess what type of acne it is or what type of skin condition it could be. So what do we think this first one is? So this would be whiteheads or closed cometones. So what do we think B could be? It is pretty obvious. So this would be blackheads. These are open comedones. Okay, going on to C and D. What do we think C is? What type of condition could it be? Is it acne? So this is actually rosacea. It's not a form of acne, but you can sometimes get pustules on the cheeks with rosacea. So what do we think D is? What type of acne would this be? So this is cystic nodular acne. So you see those cysts, you see those nodules. So this is quite severe acne. All right, going on to E. What type of condition do we think this could be? Is it acne? So this is not acne. This is perioral dermatitis, even though it is lesions around the mouth, and it is not acne. So looking at F, what type of acne do we think this is? So this would be cystic acne, so it's a large cyst deep under the skin, and this is the type of acne you do not want to pick because it can cause scarring. So again, acne is caused by many factors. So the main ones include excessive keratosis of the sebaceous gland, which are our sweat glands. There's increased sebum production during puberty, and then there's the presence of the bacteria that causes acne in the sweat glands, and the development of the inflammatory condition of different intensities, obviously different severities. So there's also different genetic factors, immunological factors, hormone conditions, stress-inducing conditions, and bad eating habits. The genetic component of acne has been described in certain twin studies done, citing that late adolescent acne patients usually have at least one first-degree relative with this condition. So if one of your parents had acne, more likely you would have acne. Also, different environmental conditions can affect the development of acne, such as professional, different cosmetics, medicines, and certain psychological factors, again, like stress, and again, dietary factors like hyperglycemic foods, milk, dairy, certain meats, and also lastly, smoking can actually cause acne. Smoking causes a deficiency in antioxidants, which can lead to modifications in sebum composition, which adds to severity and presentation of acne. So, there are many causes of acne. Diet is something that I have dealt with myself, that I've actually changed to help with my acne. So, a lot of dairy consumption or high glycemic diets can actually, cause acne. It's been seen. And, some helpful foods that I've found for clear skin is like quinoa, brown rice, sweet potatoes, carrots, lots of greens like spinach, also tomatoes, blueberries, and cherries, which have a lot of antioxidants. Some acne trigger foods that I have found are dairy, alcohol, seaweed, energy drinks because of caffeine, peanuts, refined sugar, and excessive simple carbs and soy. So patient adherence or a patient's commitment to treatment regimens is a significant problem across all of dermatology, and it can be especially pronounced among adolescent and preteen or high school patients, even when conditions are highly visible and negatively affect self-esteem. So overcoming barriers to adherence is the key to effective acne treatment. So there are two types of non-adherence. So primary is when a patient never even begins taking the medication, and this is usually due to like lack of knowledge, confusion about usage, a weak physician-patient relationship, fear of certain side effects or adverse reactions, and cost. Cost is a big one. Secondary non-adherence is when the medication is started but not taken as directed. This is usually due to lack of results, complex regimens, with multiple different medications, side effects, busy lifestyle, forgetfulness, inconvenience, or psychiatric comorbidity. So, insufficient adherence can lead to reoccurrence of acne, patient dissatisfaction, and increased medical costs. So, what can we do to fix this? The discontinuation rate owing to unresponsiveness was actually the highest in patients with severe acne. The rate of side effects is actually significantly higher in patients with comedonal dominant acne due to using retinoids. Topicals. So unresponsiveness is actually the most common reason for discontinuation among all patient types, with the highest significance in patients with severe acne. So some strategies we can do to treat compliance, and some solutions would be simplify the treatment, different technology, like electronic transmission of prescriptions, text messaging, follow-up phone calls, and, educating the patient. So some strategies that I researched was ask, don't tell. When you are talking with a patient, especially a high schooler, and trying to get their attention, you need to ask open-ended questions and to reinforce different realistic expectations and short and long-term objectives and crucial take-home points. So the overarching goal is to get teens to open up and give the answers that you need to effectively treat their skin condition. So troubleshooting adherence issues. So we have to always try and ask patients what products they're currently using, ask them specifically, have them demonstrate how to apply the product from start to finish. This simple exercise can actually help identify any compliance issues and provide a unique opportunity to troubleshoot problems in real time. Another trick is to ask patients how many refills they might have this far. This exchange can, help the dialogue regarding any obstacles or any side effects they're having with using their acne or medication as directed. And last, honesty is the only policy. All patients, they need instant gratification. And unfortunately, there's no such thing when it comes to acne. So teens want to see results like yesterday, or they will lose interest. So for topical therapy, we must tell them they could take about 2 months minimum to see if a new regimen will be needed to try something else. Or antibiotics can sometimes be successful a bit sooner, but now we're dealing with the resistance of antibiotics, and we don't want people being on antibiotics for a long period of time. So getting down to one of the biggest parts of my presentation is how acne negatively affects those dealing with it, and how it causes psychosocial effects. So, just when our appearance, becomes so important when we are going through puberty, we want to look our best, and acne is what, starts in puberty, is what we dread the worst. And, some people are unfazed by acne, but most teenagers, visibly have skin problems, and this can be very upsetting. And although dermatologists are skilled at treating acne, these invisible psychological scars can be left by this disease of acne, and it can majorly affect self-esteem and self-image. We define self-esteem as the reasonable or justifiable sense of one's worth or importance. So, this disease negatively affects the quality of life in young people, especially females, who are the majority of cases and who do not accept their appearance. So, studies have characterized the relationship between acne and outcomes resulting in anxiety, depression, embarrassment, lack of confidence, social dysfunction, and employment. And reducing this impact is one of the guiding principles for clinical management and is important to measure and evaluate this impact. So, despite adolescents' vulnerability to acne's psychosocial effects, there surprisingly is little research paying attention to these effects, especially in this age group that it affects the most. So basically, we know that acne can, negatively affect high schoolers. So we have to find out, what are all the different effects. So psychologically, again, it can cause depression, anxiety, sometimes suicidal ideation is more common in people with severe acne. And so adolescents are actually particularly more at risk of psychiatric disorders since they are more psychologically unstable and susceptible to appearance changes. So if these disorders go undetected and untreated, the consequences can be severe. So emotional consequences, skin conditions severely impact self-image. Acne can cause feelings of isolation, loneliness, lower self-esteem, and lower body satisfaction. And scarring in itself is, visible, and patients can feel self-conscious and struggle with personal, work, and social relationships, and even communicating with people, being worried that their visible scars, people are staring at them, and this can again affect, quality of life. Physical again would be, the acne marks and scarring that can occur due to the aftermath of acne, and then even the socioeconomical impact of acne can, negatively affect quality of life because there could be a huge financial burden on patients and families in society because prescriptions are quite expensive, so are dermatology visits, and this can, cause a lot of issues. So what can we do to help with these negative effects of acne on patients' quality of life? So basically, we have to think of it of holistically what we can do. So we need to treat the skin condition itself, and we have to provide wider peer and psychological support as well as shared decision making and therapeutic patient education and involving a dermatologist in improving the outcomes. So by, appreciating the full impact of the condition and, having well-rounded patient-centered treatment with treating the skin condition itself and having mental health support and education, the patient has a better chance of optimal treatment outcome.
Now we're going to do a learning activity. It's going to basically be skincare fact versus myth. So I would have you guess if the fact I present is, again, true or not. So we'll start with the first one. Just because I have oily skin doesn't mean I need to wear moisturizer. So is this true or false? So this is actually false. So if your skin is oily and producing more oil or from sweating and from sebum, this is your skin telling you something that it needs that oil. So your skin is trying to balance the disruption it's having by producing more oil. So you need to make sure you use a moisturizer that works for your skin type. But again, overproduction of oil is a sign of your skin trying to tell you that it's lacking hydration. So it's producing that more oil because it is dehydrated. So number 2, picking skin causes more damage than help. So this is actually true. So by picking your skin, you are introducing bacteria into your skin, which can further cause more breakouts. Okay, number 3. So burns are bad, but tans are good. This is obviously very false. So whether you have a burn, whether you have a tan, it is damaged, sun-damaged skin. Burns can turn into tan. It's still sun damage, which can further on affect you later in life, where you start to get hyperpigmentation. Your skin starts to lose the elasticity. Burns and tans are both bad. So next one, exfoliating every day will unclog my pores and clear my acne. This is false. You should not do this. By overexfoliating, you are damaging the skin barrier and over drying your skin, which will in turn cause your skin to produce more sebum to take care of the dryness, which will then cause you to have breakouts. Your skin may feel smooth after, exfoliating, but again, you are damaging the skin barrier if you're exfoliating too often. You must give your skin time to recover. You also never want to exfoliate on on inflamed skin, because it can make your acne worse. Okay, next one. This is a big one. You can permanently shrink your pores. Is this true or false? This is false. So unfortunately, pore size is based on genetics. So all your pores need is basically tender, loving care to keep them happy. So all that sebum and sweat that your pores secrete is how the pores lubricate and protect the skin. So again, like I said earlier, you're producing all this oil because it's trying to give you, it's lacking hydration. It's dehydrated, so it's producing more of what it needs. So when your body excretes sweat, this is your body's way of detoxifying and cooling it down. So as long as you're, cleansing your skin at the end of the night, getting all of that dirt and grime off your skin, you can keep your pores clean and happy. Okay, next one. Another big one. Sun exposure helps acne. This is false. So sun exposure actually can cause more hyperpigmentation and dry out your skin, which can lead to more sebum production, which can lead to more acne. You're kind of seeing a little pattern here. Drying out your skin causes more acne because it causes more sebum production. This one is a good one as well. So sleep is vital for healthy, vibrant, and youthful skin. This is true. So sleep deprivation can cause acne due to higher levels of stress. So more stress can add to incitement of your adrenals, which is responsible for delivering hormones called androgens. So this can cause insulin resistance and more inflammation. So having good sleep, like that 7 to 8 hours, can promote hormones that will actually heal your acne overnight, activate your immune system, and promote tissue regeneration and reduce stress. So sleep is so vital for repairing your skin at night. All right, and lastly, I do not need sunscreen while indoors. Many people will go back and forth on this, but this is false. You do need sunscreen while indoors, because UV rays will penetrate through windows and curtains too, so you are still getting UV exposure indoors if the room has a window. In 2012, CBS News showed this photo of a truck driver who had been driving for 28 years. And you can see on the left side of his face from that window how much sun damage he developed. It's pretty significant. So whether you're indoors, if you are near a window, you will get UV exposure, which can cause sun damage. So sunblock is so important. So now you're going to hear a little bit of tips from my friend Andrea, who is a licensed esthetician. We actually worked together in a dermatology office in Boca together for almost 2 years. So I trust her very much, and she's got some great tips.
Hi guys, my name is Andrea. I'm a licensed esthetician, and I want to share with you some tips regarding skincare, things to help prevent acne and pigmentation. First and foremost, what I always like to say is if you are not wearing sunscreen, 100% you should start wearing sunscreen. One thing, especially in Florida, it's so hot, it's so humid, we're always out and about. If we have concerns such as acne, pigmentation, sunscreen is going to be that #1 factor that helps prevent that from getting worse. So SPF 30 or higher, Definitely apply that every single day and get in the routine of always applying sunscreen. If you are a picker, try not to pick at your acne. Most times when I have clients come in that have pigmentation from acne, it's normally from them trying to pop their pimple, and they end up making it worse because their nails are really digging into their skin and they're causing darker spots from trauma of them scratching their face. So I always recommend, if you have any concerns, seeing an esthetician, someone who's a professional that can really help you pop that pimple the way it should be popped, so you don't have to go through, more pigment issues. Maybe things, even if you're a big sweets person or like fried foods like myself, try to maybe even, limit yourself from having it every single day. I would say if I want like some sweets, if I know I had a soda today, maybe tomorrow I won't try to have another soda, or wait until the weekend where you can kind of just limit your intake of sugars or dairy, even dairy products like ice cream or like cheesecake. That's my thing too. Definitely try to be careful with that, with consumption of dairies and sugars, because all that stuff does contribute to acne and inflamed acne. And acne only leads to, more acne or more pigmentation, which pigmentation is like one of the biggest things and most stubborn things to treat in skincare. So I definitely recommend just being careful with that. Another thing is things that you can help prevent. So I mentioned sunscreen. Definitely get into like maybe a skincare regimen. If you don't have someone who you go to now for facials, the basics are very easy. You wake up in the morning, you wash your face, you use a moisturizer and sunscreen. At night, you can wash your face, maybe use a corrective serum if you have like an acne issue or a pigment issue. Use some kind of corrective serum. Some people like, for acne, I like to recommend things that have benzoyl peroxide. The peroxide oxidizes that acne bacteria, and it helps kill that bacteria and the acne. So it definitely helps with, kind of getting through that whole healing process of the acne, and also moisturizing at night. Some people really believe when you have oilier skin types that you don't have to moisturize, which is not so. So they try to dry their skin out, and what happens is their skin tries to make more oil to take care of what you're taking off. So definitely you want to make sure you wash your face, you still moisturize even if you're oily, and put that sunscreen on. There are certain things you could do if you aren't a big fan of sunscreen. Some of my clients say, oh, sunscreen is too oily, it's too heavy. Find a sunscreen that works for you. There's some sunscreens like Supergoop. That's a really matte sunscreen. You can find Supergoop in Sephora or on Amazon. It has like a very matte finish, and it's not too oily. There's also cleansers like hydrating cleanser. I always like to recommend a hydrating base, especially being out in Florida. Even if you have acne or pigmentation, you always need some kind of hydrating factor. It does not matter. You want to make sure your barrier is healthy, so you're not just drying out your skin of oils and then your skin has to recompensate for the oil that you're drying out. So for sure, my first ingredient in everything I like to do is hyaluronic acid. So it definitely has a hydrating base, and it helps with your barrier not being compromised. Compromised meaning dry, irritated. Whenever you put something on your face, it feels itchy or inflamed. So definitely that's the idea of a compromised barrier. So stop what you're doing if that's you. Use basic stuff, a basic hydrating cleanser, a basic moisturizer. And then I definitely recommend seeing a professional esthetician, dermatologist that can really help you figure out your skin and what your barrier is and get you to where you want to be. Like I said, I just want to do a short little clip. I have so much stuff to talk about, but let me know if you have any other questions, and I hope this helped you for in the future. Bye.
So to finalize my presentation, what did you learn? So my goals for this presentation, again, were to talk about the different treatments of acne, the different types, the different stages, helping patient adherence, and educating patients on their treatment to better help with compliance. To understand how acne negatively affects quality of life, and what we can do to help with that. So a big part of this is about awareness that, remember that acne is normal. You do not have to have perfect skin. You are beautiful in your own way. Your acne says nothing about you and who you are as a person. It doesn't mean you're dirty and that you don't take care of yourself. You need to try to just not get caught up of what different placement of acne is on your skin, meaning so you are beautiful just the way you are. And while I can recommend different treatments and different lifestyle changes or different things that you can do to help to eat for your acne, these are important things. But at the end of the day, acne or no acne, you are beautiful just the way you are. And one of the things that we need to do that I feel like can definitely help with it stopping to negatively impact quality of life is wider support. We need to educate society and decrease the stigma about, we need to be perfect and that acne isn't normal. And it will help, some factors affecting the psychological well-being of patients with skin conditions. So if you have any questions, just post a comment and I will get back to you. And at the end of my presentation, these are my references. Thank you so much and hope you have a great day.